Hi, my name is Max Konig, and I'm a physician scientist at Johns Hopkins, working on cellular and antibody-based immunotherapies for treating rheumatic diseases and cancer. Our current work, a collaboration between rheumatologists like myself and our colleagues in oncology, was inspired by a major need of our patients, that we currently do not have any precision therapies for rheumatic diseases. Today, in order to control and achieve disease remission, we use broadly acting immunosuppressive drugs that reduce autoreactive immune responses, but also dramatically impair normal function. This lack of precision has real-life consequences for our patients. Risk of severe and opportunistic infection, a primary cause of death in patients with systemic autoimmune diseases, inadequate vaccine responses, reduced anti-cancer immunity, and often inability to further escalate therapy safely. Now envision an ideal treatment for autoimmune diseases. Drugs that can selectively eliminate the drivers of autoimmune damage while preserving the protective immune responses. Such therapies would have the potential to control disease without increasing the risk of infection. Our overarching goal is to develop precision immunotherapies that can achieve just that and change how we treat patients with rheumatic diseases. Inspired by the curative potential of engineered T-cell therapies that have revolutionized the treatment of B-cell cancers, we developed a first-in-class engineered T-cell technology, which we call chimeric autoantigen T-cell receptor T-cells, or short, catchers. Catchers are antigen-directed engineered T-cell receptors which can reprogram a patient's own T-cells to selectively recognize and kill autoreactive B-cells without depleting normal B-cells. To achieve this, we used CRISPR-Cas genome editing to introduce and express relevant autoantigen or epitopes as part of the T-cell receptor CD3 complex on human T-cells, also eliminating the reactivity of the native TCR in parallel. When expressed on the cell surface, catchers convey novel antigen specificity to T-cells, allowing them now to selectively bind and kill autoantigen-specific B-cells. In its first application, we designed catcher T-cells for the treatment of patients with antiphospholipid syndrome, or APS, in which autoantibodies against abundant phospholipid binding proteins, beta-2 glycoprotein 1, cause recurrent thrombosis and fetal loss. We show that beta-2 glycoprotein 1 catcher T-cells are both potent and specific. Catcher T-cells eliminated pathogenic anti-beta-2 glycoprotein 1 D1 B cells in a dose-dependent manner without depleting normal B cells, and did that at effector to target cell ratios that can be easily translated into the clinic. This depletion of APS-relevant autoreactive B cells also abolished autoantibody levels. We are very excited about the future of these and other precision therapies for our patients with rheumatic diseases, and please join us at Plenary Session 3 on Monday to learn more.